what's up, everybody? This is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance. We're back again with another episode of the Audiologist at Home episodes, and today we have Dr. Naim. How you doing, Dr. Naim?
Good morning. How are you?
I'm doing great. We have a rainy day here in New York, but it's okay.
It's okay.
So we have another interesting question for you today, which I hope it's not too broad. I hope you'll be able to answer this one. And I know you'll be able to answer this one. So the question is, we talk about different types of hearing loss, and throughout the videos, we've been talking about different causes of hearing loss, but I wanted to get a little bit more basic. So when we talk about hearing loss, there's essentially two categories. There's congenital, and then there's acquired hearing loss. Maybe you can describe the differences between the two of them.
Yeah, absolutely. So when we talk about congenital versus acquired hearing loss, we're really talking about the time at which it appears. So congenital is talking about hearing loss that is present during birth, whereas acquired hearing loss is a hearing loss that comes after birth or even later on in someone's life. And it can happen at any time. There are a few different causes for each of them, and I'll go through the different causes.
Sure.
With congenital, it's really due to factors that are present either in utero or, again, at the time of birth. So that could be genetic causes, intrauterine infections like measles or cytomegalovirus, Rh incompatibility in the blood of the mom and the baby. So some complications with birth where there's prematurity, maternal diabetes, lack of oxygen or anoxia, and if the baby is spending time in the NICU or spent time in the NICU.
Gotcha.
Whereas with acquired hearing loss, it's coming again later in life. So that can be from measles, mumps, head injury, meningitis, ototoxic drugs, which are drugs that affect the auditory system, can even be ear infections, otitis media, and even some noise exposure can definitely have an effect on someone's hearing, as we know. So yeah, I would say that's the main difference between them and some causes.
Gotcha. So a lot of this is geared towards children and maybe parents of kids who might have some concerns. Clearly, most kids, if not all kids, there's universal hearing screening. They are screened before they leave the hospital. In many cases, and we've seen this in our practice because we dealt with a lot of pediatric and we deal with a lot of pediatric cases. Even though a baby might pass in the hospital, it doesn't necessarily mean that they're safe for good forever. Things can happen, as you described, later onset over time. But let's just say that I'm a parent and I have some concerns. What are some things that we should look for if we're concerned that our child might have some hearing loss?
So that's actually a really good question. And I'm glad you mentioned the newborn hearing screening. So it's really, really important. And yes, most children before they leave the hospital are screened. Now, let's say that they don't pass in the hospital. That could be due to fluid or debris in the ears. It's really important that they are identified within 3 months of birth. And if they are identified with a hearing loss, early intervention is key just to make sure that we catch it sooner and we start implementing things where we can help the child develop speech. Now, some things that we should look for, especially because speech development happens within the first few years of life. What we should look for is that within the first 3 months, they will usually recognize a parent's voice. By 6 months, they'll actually turn their eyes or their head to a sound. And by 12 months, they can actually imitate sounds and produce a few words like mama. Now, when we move on a little bit later in life, and again, it's really important even as toddlers to continuously screen their hearing just to make sure that we don't have an acquired hearing loss. But some things you'll see is that they'll have limited or no speech or poor speech. They're inattentive, they have difficulty learning or focusing. Another big sign is that sometimes I'll actually need the TV to be a little bit higher. They won't respond to their name. They'll get frustrated when there's background noise. Another one is that they'll fail to respond or answer a question appropriately at conversational level. It's just small little things that we can all look for with our kids just to make sure that they're on the right track.
Sure. I think awareness is super important. And just because a child, and it really depends, there's so many different variables here as you're outlining, and so many other things that we don't have time to talk about in a 5 or 6 minute video necessarily. But, genetics come into play, as you said. But, where the child falls in line of the child order, if they have older siblings, if they have younger siblings.
Oh, absolutely.
That comes into play as well. Oftentimes, what we've seen throughout the years is that the younger sibling doesn't have to speak as much because the older sibling is speaking for them. So it doesn't necessarily mean that they have hearing loss. They just don't have to communicate in order to get what they need.
Right.
That said, I think what you're saying is it's very important for us to be aware of those subtle signs, because the little things can tip us off to say, well, look, maybe we should have some testing done just to verify if something is going on with our kiddo. Yeah. So most important lesson is be aware for the parents and test on a regular basis.
Exactly.
Awesome. Great information today, as usual, Dr. Naim.
Thank you.
And for those of you out there who have questions, you can send them to info@newyorkhearingdoctors.com. We're happy to answer them in these episodes. Dr. Naim, I hope you have a great day.
You too. We'll see you soon.
We'll talk soon. Take care. Bye-bye.
Bye.